Hi, my name is Jordan, and I've done my research project based off the question of should women who are addicted and use drugs during pregnancy be charged with child abuse, or should they be placed into treatment? This slide discusses the different outcomes that could happen to the babies who are exposed to drugs while in utero. For example, alcohol consumption during pregnancy can cause low birth weight, stunted growth, stunted height, learning disabilities, behavioral problems, and many other issues. During pregnancy, there are many stages that are very important for the child to fully develop. Using different drugs such as cocaine will not allow the baby to develop properly. These different effects can be lower birth weights, length, and a smaller head circumference. There has also been reports of sudden infant death syndrome within infants that have been exposed to cocaine while in the womb. Exposing babies to drugs while pregnant not only exposes them to issues while developing and issues associated right after birth, such as withdrawals, but it exposes them to issues that they can have and will face as they grow older. Some of these issues include temperament, poor self and emotional regulation, higher arousal, overreacting, and being hyper. Children are also more likely to have learning disabilities, which is based off of not being able to pay attention. These children are also distracted more often. This is when the research question came in after reading about the different effects that drugs can have on a child during pregnancy. This made me question if these women could be helped with their drug use, or should they be charged with child abuse. Most child protective services will take the child away from the mother once she has given birth and has tested positive for drugs. The courts in some states have decided that although there will most likely be abuse for the child after pregnancy, once going home, but they view that the abuse during pregnancy is more profound, so they want to take immediate action and take custody away from the mother so that she cannot do any further harm. Many states have issues with getting approval to charge these women with child abuse, so they have other laws that are pre-existing to charge these women with some sort of a criminal charge. This is their backdoor way of making sure that these women pay for the abuse that they've done to these unborn babies. Some states have been successful in criminalizing drug use during pregnancy, and for other states that have not been able to criminalize drug use during pregnancy have added fetuses to the list of potential victims so that they will be able to charge mothers with child abuse, but not specifically for doing drugs during pregnancy. It's a way of charging them without having to make new laws. So for states that do not have the full support of the criminal justice system, they will use CPS to label these mothers as child abusers so that they take the child away and put them into custody or foster care, which then creates a battle for the mother to get her child back. The benefit of punishing women that have used drugs during their pregnancy is very beneficial to our society because the health and well-being of the children is being considered over the adult who has placed these children into harm's way. Punishing these women will hold them accountable for the harm that they have done to this baby and the future harm that they will go through due to being addicted to drugs at such a young age. The issue that many states are having with charging these women with child abuse or any criminal charge then causes these women to not want to go seek treatment while they're pregnant, so it makes the court systems not want to help these women. It makes them want to just charge them with child abuse because they have a fear of being sent to jail or prison because they're trying to seek help, so they just continue using while they are pregnant. Other studies have shown that there is no actual proof that these women have a fear of being charged with child abuse and are not seeking help because of that. They are not seeking help for other reasons. So they don't have a fear of the law. They just are addicted and want to keep using. These studies have also shown that these women have not changed anything about their behavior or their drug use because of fear of prosecution.